So Julian, shall we discuss what happens when the patients come and visit us in nose clinic for their rhinoplasty consultation?
Absolutely, yes. I think it's important that everybody understands that our real goal here is to work out what's in the patient's best interest. We're talking about part of medical practice here, and therefore our decision making must be informed by that good clinical practice framework. To that end, we really want to work out what the patient is hoping to achieve. And that's not just from a cosmetic point of view specifically, but it's also from a psychological point of view, how they think their life is going to be better on an everyday basis from rhinoplasty. We are then in a position to be able to work out, can we achieve what they want and meet their expectations? And of course it's fantastic when we can. To that end, part of what I do is also not just with your help understanding their expectations and their specific wishes and their worries, but also to work out exactly what is possible for their nose. If the patient likes what we think is possible, I can spend a very significant period of time studying their photographs in depth, really understanding how I'm best going to achieve what they want with my surgical experience. Of course, we have to communicate all this to the patient, and that's very much your role, and you see them first.
Yes, I think I greet them first and explain the process to them and how we're going to manage them during the consultation. But I think my main role is one of support actually in helping them communicate their hopes and what they hope to achieve through having their surgery.
I think you're right. We're very much about information provision. There's a huge amount of information on the internet, but it can be very confusing and it can be out of context. So as well as recognising and understanding our patients' hopes and desires, which comes from listening, we also ask a lot of directed questions, but then knowledge broke after that. I think you'd agree that our goal is that when our patients leave here, they feel calm, confident and in control because they've got the information they need to make a proper, informed decision. There are, of course, specifics in the steps, and specifics involve understanding not just the patient's psychological and physical hopes and wishes, but me understanding their nose as well. And after they've spoken to you and I've reviewed everything that you've discussed with them, I will examine their nose very carefully, inside and out, because the nose has to function as well as look good. So that aspect, the internal aspect of the nose, is very important as well. Tell me about the photographs though, because that's very important as well, isn't it?
Yes, I think so, and I think the patients rely on those photographs. I think they're very helpful in many ways because as we talk them through the photographs, we help them understand their nose, how it is now, and therefore I think it's much easier for them to actually understand the changes that can take place. So it's helping to manage their expectations. And in some occasions, the patients come and realise that with good quality photographs, their nose isn't as bad or is different from what they thought. So it can educate them as well, which I think, again, is another very helpful aspect.
And it helps them explain to me what they're hoping to achieve. So as I change the image on the computer screen for them, they can say, yes, that's right, or no, that's not quite enough, or well, that's a little bit too much. So it's a fantastic aid to communication. But it's very important that patients know it's not a guarantee for how things are necessarily going to work out. And I think a very important part of your role too is explaining the risks, limitations and unpredictability of surgery. So although we're fastidious with attention to detail and we desperately try to minimise risk, we can never make it zero, and it's important that they understand that.
And I think that's all part of an informed consent, and I think the patients appreciate hearing that. And I also take that opportunity to talk about the recovery process. So we go through all the operation plan again in great detail. And I think therefore they leave the clinic, as you said earlier, calm, full of confidence and able to make a decision. Absolutely.
And aware too of the costs. So we're very transparent about those as well. So we hope from a very comprehensive and quite a lengthy visit that they will have got all that information at their disposal to make the decision that's right for them.
Absolutely.